Okay, good morning, everybody. Thanks for joining us today. You are here for the CFSS Provider Agency Office Hours, and my name is Erin Holdeen. I'm the CFSS Policy Lead here in the Disability Services Division, and I'm joined by Janine Wilson, who is the Supervisor of the Home Care and Self-Directed Team. I don't think Jamie was able to make it today, although her name is on the slide here, but I think we have somebody on the call who can represent the provider eligibility and compliance team if needed. So we'll go ahead and get started. I don't have a lot of slides to go over today, and so we can use most of the time to go through just any questions that you guys have. But we'll just do a couple short overview and reminders about CFSS, give a quick enrollment update, and get to the point of the session where you guys can answer or ask your questions in the chat. So quick reminder that we offer monthly meetings to all of the following groups. So we meet monthly with consultation services, lead agencies, you as CFSS provider agencies, and then we also attend a monthly FMS meeting. So we just want to make sure that you're in the correct meeting for the provider type that you work for. Of course, if you work for one of these other providers or for a lead agency, you're welcome to listen in today, but just know that the questions that will be in the chat, we'll be answering those for just the CFSS provider agencies. If you're not yet aware, we do have all of our CFSS forms and documents published. They are a part of our CFSS policy manual, so you can find them there, or you can click on this link when you get a copy of this or when you review a copy of this PowerPoint presentation. These presentations are always listed on the DSD Training Archives page, so you can go ahead and find those there. And then just a reminder that CFSS provider agencies need to remain neutral when you're providing information to people. So this is some information that may help you review the information that we have published or possibly give to people receiving services. You're welcome to give them some of these links if they wanted to look up information on their own. So you can go ahead and get copies of these links on the DSD Training Archives page. And just a quick update on the CFSS provider agency enrollment. We have nearly all PCA agencies are now enrolled to be CFSS provider agencies. There are a few lingering out there that have not made that transition yet, and a few that have chosen not to become CFSS provider agencies, but almost all are. So thank you all for working really hard to get that completed. If you are listening in and you have not been enrolled as a CFSS provider agency and you're interested in doing so, please go ahead and you can send us an email and we'll get you in contact with our enrollment team. A quick update on our consultation services providers. We did reduce to 17 consultation service providers on July 1st. So we had 18, we've now reduced to 17. But we are planning to post the consultation services provider RFP soon. We're hoping within the next couple weeks, although if there is a slight delay, please be patient with that, but we're hoping just within a couple weeks that RFP is going to be posted. We'll then go through, people can submit a proposal and then we'll go through a selection process. So it will be, a few months until the new providers are selected to provide consultation services, but we are in the process of trying to get more than the current 17 that we have. Okay, so that is all the slides I have for today. That was pretty simple. So we just wanted to open up the rest of the hour for you to be able to ask any questions that you have. If you want to go ahead and put those in the Q&A, and then Janine and I will do our best to answer those today. Or if we don't get to all of them, then we can answer questions through email as well. So we'll pause here for just a minute and give you a minute to type up your questions in the Q&A. Okay, the first question that came in was, can a CFSS agency provider also be a consultation services provider? So yes, you can. We have many different, or an organization can provide many different services or be many different provider types. However, you can't provide more than one service to the same person. So in other words, you can be a CFSS provider agency and you can be a consultation service provider, but you can't provide both services to the same individual. Okay. I see a question. What is the wait time currently for CFSS consultation services delivery plan? I'm thinking you're meaning the CFSS service delivery plan for the individual. And when you mean wait time, I think it's all going to vary depending on which consultation services provider they've selected. It's also going to vary depending on the person, how quickly the person can develop their own individual service delivery plan with their consultation service provider. So is that person available to meet right away? Do they have a very complicated plan or a relatively simple plan, right? There's a lot of variables that will play into that. So we don't have an exact time of how long that will take. But if you have more clarification on maybe a little bit more, if I'm misunderstanding your question, feel free to put more in the chat.
Erin,
Yes.
there is a question about annually and annual and annually. Um,
Okay. Meaning that if it's within the same month or within the same calendar year?
yes, so I'm wondering about for like quarterly visits or any of those kinds of things, those are really based on when you start providing CFSS to the person. And so it's not really, it's not like a calendar year. It's really based on when you started serving the person and what their span of eligibility is. If there's a question about reassessments, for instance, when someone has a reassessment, it is it's for 12 months, but you end it like at the end of the 11th month generally. So like an ending on September 30th would be a beginning on October 1st. And last year, if someone had an assessment in October, you would only be able to bring it through the end of September this year. Because we don't do partial months basically. So you might have a start date that's in the middle of the month, but we run it through the end of months on our service agreement.
Thank you, Janine. There is a question asking if a person, I think this means a provider, they're an approved provider for the elderly waiver. Are you already approved for CFSS? So no, not necessarily. No, you have to be an enrolled CFSS provider agency in order to provide CFSS. And so if you have questions on what that looks like for your organization, I think you should probably call the provider enrollment team or contact our provider enrollment team. Okay, so there's a question about service authorizations for CFSS provider agencies where the lead agency is backdating the service agreement. So the example says if the service agreement is coming to you as a provider agency on July 14th, but the start date says July 1st. And then the question is, are we going to post something saying that they cannot backdate the service agreement? So we do have something, I believe that's already been posted in our policy manual. We were working on that over the last month or so to have some language stating that lead agency needs to coordinate with the provider agency on a date that a person can transition from PCA to CFSS, and that date needs to occur in the future. I know that we have not had an opportunity yet to update our FAQ page, but we do that information has been provided to the people who make those updates on the FAQ page. And so hopefully you'll see that update published soon.
And we have actually talked to lead agencies
Mm-hmm.
extensively about this
Mm-hmm.
because I think, maybe we started talking about it back in January or February, but we've been clear to lead agencies just saying there are new rules. And so even if you're a provider that that is currently serving them under the legacy PCA and they chose you for CFSS services, there's still things that have to happen before CFSS can actually be provided and billed. And so we have talked with them a lot. We asked them to coordinate with the provider to be sure the provider was ready for that start date as well. Um, so we can actually bring it back to our next lead agency office hours and just remind people.
Mm-hmm.
But we have said that a number of times in the past.
Yeah, and kind of along the same lines, there's another question in here saying, asking why lead agencies aren't letting providers know when someone is changing to CFSS, and that you're billing for PCA and that billing is getting rejected. So you should be getting a service agreement for CFSS. So watching those service agreements and making sure that you are aware that the person, you should be receiving a CFSS service delivery plan with a start date on it and a service agreement with a CFSS service agreement with a start date that matches the service delivery plan. So that is how you would know that someone has transitioned over to CFSS. And like Janine and I just said, that shouldn't be backdated, right, to like the beginning of the month if you're getting it mid-month. So if that does occur, I would recommend contacting the lead agency and you guys can work together on that date.
So I think the other thing, Erin, is if someone chooses to go to the budget model, which would not be
Oh,
working with one
mm-hmm.
of you guys, your PCA service agreement would end, and you wouldn't know that they went to CFSS or picked the budget model, but you would have an end to your PCA service agreement that you should get a copy rather, into your minutes mailbox.
Thank you.
Yeah.
Janine, I'm seeing a lot of comments here about annual and annually. I'm not sure if these were said before or after you answered that question. So I don't know if you want to, while I'm looking at the other questions, if you want to take a look at those and just see if those need to be answered as well.
Sure, sure. So annually is um, once a year for reassessment. So basically, your assessment is due a year from when you've done your assessment. But we have the ability in all of our assessments that for someone to do an assessment up to 60 days ahead of the end of a service agreement. And so an assessment that is done, for instance, if a service agreement ends September 30th, you have September and August. You don't, but the lead agency has September and August to do the assessment and still have it timely. Once you're doing assessments after the end of service agreements, that becomes an issue, and there are certain things that can happen, but annually is really in the 60 days prior to the end of the service agreement, and that's how we deal with annually, once a year, and you can have flexibility in assessments up to 60 days ahead of the end of the service agreement.
Thank you. Um, I see a question saying, what is the documentation process for CFSS clients? If you can provide us a little more information on just some more detail about what you're referring to with the documentation process, that would help us answer your question. Another question of if if CFSS provider agencies are supposed to be asking the lead agency for the service agreement for a consultation service provider. No, you are not. The lead agency is going to be entering the service agreement, and that's automatically sent to the consultation service provider through MMIS. So you do not need to do that. That is all. And if a consultation service provider needs a change to a service agreement or something that they're connecting with a lead agency independently, you don't need to be asking for the consultation service provider. Okay, so there's a question asking if there's any more education planned for people receiving services, that they get a lot of um, questions from individual people. So yes, actually, we are doing a pilot training today for people receiving services, and depending on how that pilot goes, lead agencies have the opportunity to offer individual or train, I'm sorry, not individual, training sessions at their lead agency that would help participate in. And so that is one thing that we're doing directly for people. We also have a lot of training material online that was designed for people receiving services so they can learn a little bit more. And then a bulk of that education should also be coming from their consultation services provider. So that is the role of the consultation service provider as well, is to provide education on CFSS.
Aaron, there's a question, probably clarification. So that CFSS PCA agency provider could not provide consultation services. Um, so what we were saying is that there may be agencies that have many books of business. One of them may be CFSS or PCA. One of them might be consultation. One might be an FMS. You might have a home health agency as well. But you can't provide more than one CFSS service to a person. So if you have all of those books of business, you can't serve them as an agency provider and a consultation service. So you only are able to provide one type of service to the person. So while you can have many books of business in CFSS, the person has to be just attached to you in one way, um, like just as consultation or just as an agency provider, not both.
There's a question asking if a provider has the service agreement but does not have the service delivery plan yet, can services begin? No, you need to wait for the service delivery plan to get to you. So if you do have a service agreement without the plan, I would contact the lead agency and ask for a copy of the plan. Maybe it just got lost in transit for some reason, but and then that service delivery plan should match the start date of the service agreement. And then if it doesn't, then you should work with the lead agency on that piece. It looks like there's another question regarding or clarification for the annual requirements, so that are not assessments. So just for specific things regarding CFSS. So going back in the chat, I think I think what you're asking for clarification on is it doesn't have to be on the exact same date every single year. And Jenny, correct me if I'm wrong, but like performance reviews for workers or reviewing services for the person, it doesn't need to be on the exact same date every year, but just annually. Um, Janine, is there a specific time frame? Does it need to be within that particular month? Doesn't have to be on the exact same date. Like it doesn't have to occur on July 1st every single year, right?
No, I don't think it has to be on the exact same date. I would get
Mhm.
it as close as possible or within the date that month, for instance, or at the beginning of the month. Um, so we, on our side, we don't have 245A or D kinds of stuff going on. So I can understand that there are definitions over there. It's on time if it's in that month or probably, right before that month as well.
There's a question about or comment about maybe some assessors are not sharing a lot of details about CFSS and just providing a link of the consultation service providers. And if no, DHS should be notified. No, I don't think DHS needs to be notified. I mean, the assessor should be telling the person that they are assessed for CFSS and then providing them the list of consultation service providers to select and explaining that they do need to work with a consultation service provider to get started with CFSS. And then the person will need to select a provider, and then that consultation service provider will educate the person more on all the details about CFSS.
So there's a question about what will happen with people who had October 2024 assessments for CFSS and haven't made it through the consultation process to transition to CFSS by the end of their service agreement, which would be September 30th. We do not have an answer for you at this point in time. We have certainly passed it up above our heads to get an answer back, and we'll let you know as soon as we know.
I'm seeing a question regarding language clarification regarding service initiation, start of care, start of service, and service start date. Janine, unless you're able to answer that, I'm going to ask that you send us an email with that question and then reference where you're seeing these different, the different languages so that we can take a look at that and provide more clarification or change something on our end if we need to. But if you can include the reference of where you're seeing these different terms, that would help us. Okay, we're just pausing for a minute to see if any new questions come through. I don't think you can all see the chat. I think just Janine and I can see it. So we're just waiting to see if more questions come through for us. So there's a question that asks if the service agreement is 6 months or yearly. For CFSS, it will be the longest it can be is a year. So there might be some people who are approved for less than a year, but a year is the max amount. So it's not in 2 6-month increments like maybe you're used to for PCA today.
I will say that during this transition, there have been service agreements that were 6 months long, and then another service agreement added that's 6 months long as well. And because in PCA we had to actually break service lines out, they couldn't be longer than 6 months. And because of some technical reasons, having lead agencies put in a separate service agreement for an additional 6 months worked so that they didn't run into a bunch of edits. So in the legacy side, you will see a variety of 6 months and 12 months on the PCA side.
Okay, so a question of if we know if there's going to be more consultation service providers enrolled. So I'll just go back a couple slides. Here we go. So we are posting the consultation services RFP very soon. We're hoping that it will be posted in or published in the next couple weeks. At that time, people who are interested in being consultation service providers can respond and they can submit a proposal to DHS, which will then review and then select additional consultation service providers depending on who submits a proposal. So we don't know the exact number of new consultation service providers that will be coming, but we are publishing the RFP again.
So there's a question about the on-site reviews from DHS. What can providers expect to be reviewed at the on-site visits from DHS? That is not us. If Jamie was here, I think she would probably have a better idea of what actually happens, because it's the OIG screening team. I'm not sure what they're actually called. So it's really them that comes out and does on-site reviews. There's a question about tiered wages. Does it apply to just the budget model and PCA choice, or does it include any workers? So tiered wages is different than tiered rates. And so tiered wages are associated with tiered rates, and say how much you have to pay the worker above the usual because of their years of experience. On the agency side, you do use tiered rates, and so the reimbursement you will get for a worker will be based on their years of experience, and that will be coming to you, and then you are responsible for paying whatever you've agreed to. SEIU has a tiered wage, which I think Erin is showing the screen now. It's above it, like the tiered wages. So you can see like the amount of hours that someone's worked since July 1st, 2027. No, 2017 rather. And then above that is like what the minimum wage is that needs to be paid. And that is for the minimum wage is for PCA choice, CFSS budget model, not CFSS agency. And I think Erin put the link in the chat as well.
Yeah, I did. Okay.
A question about having left SEIU. I think that probably is that's probably really compliance team question.
Why don't you email that question to us, and then we can get it in the hands of the correct people. We'll forward it on for you.
Yep.
Okay.
Yep.
There is a question about if somebody has multiple workers, does each worker need to be evaluated? Yes, they do. So it's if you're working with a person right now, let's say that an individual is using PCA services and they have several employees, all of those employees need to be transition over to be CFSS workers. And so you need to meet with them and ensure their training, even though that they are working for you as a PCA provider, right? It's a new service under CFSS, so that training starts over again. And all of those workers need to be evaluated.
So there's a question about for providers who chose not to transition to CFSS, are they no longer providers? That is correct. When all PCA services end, they would end as well, or they could end ahead if like all of their people transition to CFSS. But there are some that are choosing not to go forward into CFSS. Go ahead, Erin.
So someone is asking for clarification of that when a person's 6-month PCA service agreement is coming to an end, is the lead agency automatically adding a new 6-month service agreement either for PCA or for CFSS? So it will depend, right? If for CFSS, the person will have to have a service delivery plan developed and approved. And at that time, of course, they can choose the budget model. So they might be moving to an FMS provider. It's possible that they select a different CFSS provider agency. And so you may not receive another 6-month service agreement because the person may have made another choice. However, if the person is continuing with you, and you've confirmed that with the person, and maybe they have not made that transition to CFSS, so they're going to be using PCA services for another 6 months, then the lead agency should be entering that service agreement.
And I think the other piece is that, I think we've talked with agency providers, like in this group, about trying to be careful about sending reassessment requests to lead agencies, because we did have a bunch of like 6 month at a time kind of PCA service agreements. But we just got some feedback from one of our regional resource specialists that one of the metro counties was concerned because um, they're seeing like a steady drop of referrals coming in for the annual assessments. And so what they're used to seeing, they're seeing, you know, 66%, 71%, 34% on some of the months. I guess if someone's service agreement is coming to an end and you're not sure if they need an annual reassessment because of all the all the timelines that have happened in this last year, you may certainly send a referral in. Lead agencies then would discard it if it's not actually due until the annual piece, but it's not evident for you guys. It's not evident when assessments necessarily happen in black and white. I mean, assessments should be leading to paperwork and should be clear to you, but when lead agencies have been adding some 6 months to the 6 months we said that they could use early on, it might just not be evident. So just a caveat, I guess, about making sure to follow up if it is a service agreement that's ending. It may be that it needs an assessment.
Okay, there is a question again wanting some clarification regarding worker evaluation. So I just pulled up here the policy page regarding supervision and evaluation of workers. So you can see here it says for each worker, the employer, so you as the provider agency, must evaluate the worker's competency to support the person within 30 days of the worker starting CFSS, complete their initial evaluation through direct observation, and then conduct periodic performance reviews at least once per year. Okay, so that's a requirement for a worker evaluation. Okay, we're just going to pause to see if any more new questions come through. Okay, I'm not seeing anything new come through, so I'm just going to go through the last couple of slides and then we'll check the chat again in a couple minutes. So I'm assuming you're all familiar with the different resources that we have available, but if not, please go ahead and review the CFSS policy manual. That will help answer a lot of your questions. We also have our FAQ page. And then if you're not registered yet or signed up to receive the e-list announcements, we encourage you to do that. That is our main form of communication. And then we will be meeting again on August 18th, and then after that on September 15th. And we'll meet again from 11 a.m. to 12 p.m. And likely most of the time will be a Q&A session. And so you can certainly come to the meeting with ideas of what questions you have for us. And then we can answer those at the meeting. If you're not registered yet for those sessions, you can click on this link. Again, this PowerPoint presentation and recording is going to be posted on the DSD training archives page. And so you can go ahead and get that registration link there. Otherwise, if you have questions before then, you can of course email us at dhs.cfss@state.mn.us.
Hey, Erin, there are a couple more questions.
Okay.
So one is it's confusing with the tiered rate for employee because we're not part of SEIU. Do we still have to pay the employer their tier rate? No, the wage that you pay them is whatever you've negotiated. You are not held to the minimum tiered wage that that people in the bargaining unit are. So you will get generally an increase to the claim you send in based on where the worker falls in the tier. We don't, on the non-SEIU side, we don't have a minimum that's associated with that. It's whatever you've negotiated with your worker.
A new question came in again about consultation service providers. So I'll just kind of reiterate what I said a few minutes ago. We are opening the request for proposal, which is what we refer to as an RFP. We think that will be published in the next couple weeks. And at that time, if people are interested in applying to be a consultation service provider, they would submit a proposal for us to review and then possibly be selected based on their proposal. Okay, so it's not, if you're wondering, it's not like just an application or like someone saying they want to be enrolled. They actually have to respond to an RFP or the request for proposal. And then we'll make selections after that has been published. So you can watch for that. We're going to make an e-list announcement and it'll also be on our RFP page. And so if you're interested in that, you can sign up to receive those e-list announcements or check the RFP page, and then you'll know when that has been published. Okay, if we don't have any more questions, I think we can just end a little bit early, but we'll be back again. What did I say here? August 18th is when our next meeting is. So we'll plan to see you then. Thank you, everyone.
Thanks, everyone.